Māori oho, Māori tū, Māori ora, kia tātou, haumi e, hui e, tāiki e. Kia ora and welcome to the first in the Ask the Experts online series. This series of 3 online events has been organised by the Island Bay Enhancement Trust, who was set up to enhance the beauty of Island Bay and the well-being of the land and people, to enhance the cultural, artistic and social life of Island Bay. Island behind me. The Island Bay Enhancement Trust is most well known for organising the annual Island Bay Festival, and this series of online events is to support the well-being of our community, considering the cancellation of this year's festival. We hope you are warm and dry where you are, as we know this weather has both affected people in Island Bay and around New Zealand. Tonight's event is being recorded, so if you're joining us live, you can re-watch it if you want to or share it with your friends. And a shout out to anyone watching the recording, no mai, haere mai. My name is Tai, and I work for Adult and Community Education Aotearoa. I've been kindly invited to help facilitate tonight's kōrero. And tonight's topic is masks and vaccines. So I'm not an expert, but we have 3 experts who have joined us tonight. I would first like to introduce Nico Reitmeister. Nico is a recent graduate of the University of Otago with an academic background in psychology and pharmacy. He moved to Whanganui-a-Tara at the end of 2021 to commence his role as intern pharmacist at Unichem Island Bay. I'd also like to introduce Dr. Marion Layton. Marion is a specialist physician at Wellington Hospital, Mary Potter Hospice, and principal advisor to the COVID immunisation program at the Ministry of Health. She is a strong community advocate and has helped coordinate joint health and housing COVID responses throughout this pandemic. She's also a senior lecturer for the University of Otago and lead physician for Doctors for Active Safe Transport. And finally, but not least, I would like to introduce Duncan Sutherland. Duncan is a practicing pharmacist and has a pharmacology career spanning almost 25 years in both New Zealand and the UK. As owner pharmacist at Unichem Upper Hutt and Unichem High Street Lower Hutt, he has a vast experience in the New Zealand COVID immunisation program. Accredited to administer Pfizer, AstraZeneca and paediatric Pfizer doses, Duncan has vaccinated many Wellingtonians and is currently leading a mass vaccination clinic in Upper Hutt at Whirinaki Wharetaonga, with specific expertise in aged care and community pharmacy. Whawhitai te lava, and thank you all for giving up your Sunday evening to join us tonight. So to everyone out there, we've received a lot of your questions via email. So let's have less talking from me and jump straight into a presentation from Nico on masks. So I'll hand it over to you, Nico.
Thank you, Kai. Okay, so I prepared a short presentation about common questions we've received about masks and their use, as well as some general advice. I'm doing this as part of a health promotion assignment for my intern pharmacist training this year. So let's jump right in. Okay, so as you're probably aware, Delta and Omicron variants are highly transmissible, so we need to use a range of measures to help protect us from infection. As a general rule, you should wear a face mask whenever you're indoors. The exceptions are at your own home or your place of work if not public facing. However, your employer may encourage you to still wear a face mask, even if your job is not public facing. You do not, however, need to wear a mask when exercising. Everyone, essentially, when it's hard to physically distance yourselves from other people, that is the time to wear a mask. In red light restrictions, everyone must wear a mask that's attached to the face by loops around the ears or head. You can no longer use scarves, bandanas, or t-shirts as face coverings. Wearing masks is one important tool that can minimize direct spread of the virus, and measures we can take for reducing the spread of the virus include being fully vaccinated, as well as getting your booster, staying home and seeking medical attention if you are unwell, socially distancing from other people outside of your home bubble, practicing good hygiene, and keeping track of where you're going with the New Zealand COVID Tracer app. So choosing the right face mask. There are many different types of face masks, and these can provide varying levels of protection depending on the type of mask and how they are used. You should pick a mask that fits you best, and there are several things that you should think about when selecting the right mask for you. These include your level of infection risk, how well the mask fits you, the filtration ability of the mask, as well as comfort and access. However, as the government is saying, any mask is better than no mask. Face mask exemptions are given to people who have a physical or sensory disability, mental health conditions, or other health conditions that make wearing a mask unsuitable. These are issued through the Disabled Persons Assembly New Zealand. So moving on to cloth masks, and these are the fabric ones. We've received quite a few questions about these at the pharmacy. So you can still use a fabric face mask in red light restrictions, but the effectiveness of fabric face masks vary depending on the style and materials used. You should look for a reusable face mask that has at least 3 layers and are made of tightly woven fabrics, such as cotton. Ideally, face masks should use 2 different types of fabrics that allow for easy breathing, but still provide filtration and a good fit. Face masks with more than 1 layer help to contain any respiratory droplets from your mouth, as well as in the air. You can increase the protection of your fabric face mask by adding a filter layer, which could have a nose wire bridge to help it fit more snugly, as well as being a specific filter mask layer, which you can get at a lot of pharmacies, or you can cut up a disposable mask and slot it into the pocket as well. Or alternatively, a filter layer could be wearing a disposable mask underneath your fabric mask. But the message is that fabric face masks can still be effective for short periods of time in well-ventilated areas. One of the big common questions we get is cleaning and reusing a lot of these masks, because we'd like to think about sustainability. So when cleaning a fabric face mask, you should wash them daily after use, using soap and hot water, while allowing them to dry completely before using them again. You should have at least enough mask to wash one and wear one alternatively. Check them for wear and tear frequently to ensure there are no holes and are still in good condition. Many stores and online retailers will offer these types of masks. You can also make them at home on your own, but ensure they have at least 3 layers. There has been some discourse about the ASTM rating system. So the ASTM International is an open source organization that defines and sets standards for a variety of products, materials, systems, and services used by people every day. These standards are created to enhance the performance of these work tools and improve the lives by promoting quality and safety. Basically, it's another way to gauge how effective your PPE is, which is your personal protective equipment. Moving on to the common disposable medical masks. Disposable masks with ear loops can offer better protection for longer periods of time than fabric face masks, especially in higher risk indoor settings. These are widely available, and the blue medical masks are often known as medical, surgical, or procedural masks. For use in healthcare, they must comply to a certain standard, and although some disposable masks are not certified to the healthcare standard, they may still provide effective protection when worn correctly. So when fitting these masks, you want to pinch the nose wire around the nose. Try layering them with a fabric mask over top. Use the knot and tuck method that we'll cover a wee bit later, or try pulling the ear loops back and securing them with a hair tie or clip. We advise to try and avoid using the figure of 8 ear loop technique, because it often creates holes at the sides of the mask that can allow viral particles to come in. And when cleaning disposable face masks, you can reuse them up to 10 times if you wash them effectively. And you do this by submerging them under boiling water for a few minutes and allowing them to dry completely before reusing. Continuously check them for any signs of wear and tear, because if they're no longer fitting you snugly or have holes or aren't attaching well, they should be replaced. Now, just further notes on fitting face masks. So familiarize yourself with the orientation. The mask should have pleats that are facing downwards, and the blue side should be facing forwards. And the nose bridge should be at the top over the nose. Continue to practice good hygiene, hand washing, sanitizing, avoid touching the face and the mask where possible, and changing masks when they become damaged, dirty, or damp. So I have a short video here just on a technique called the knot and tuck method, which can help improve mask fit.
There's a simple way to make your disposable mask fit better, which can make it more effective in protecting you against COVID-19. First, fold the mask from edge to edge. Then, make a knot in each ear loop. Push the knot as close to the edge of the mask as possible. Next, fold and tuck the extra material under the edges of the mask. Hold the mask up to your face and gently push the nose wire against your nose so it fits snugly. Place the ear loops around your ears as you normally would to secure the mask. Be sure to remove any gaps in the mask around your nose and cheeks for the best protection. And this is what we call knot and tuck.
All right, and on to our final category of masks. And these are ones in particular that we get a lot of questions about in a pharmacy setting. So disposable high filtration masks or particulate respirators are often the highest level of protection, but only when used correctly. These masks work best when a person is fit tested so that there is a tight seal against the wearer's face. It's important to follow the manufacturer's instructions on how to mold these masks to the face so there are no gaps. These masks can offer hours of protection when in high-risk indoor environments where there is little or no ventilation. However, then there needs to be a tight seal around the face, or these masks do not provide any better protection than a well-fitting medical mask. There is an issue with availability with these masks right now, and they are slightly more expensive and harder to source from overseas than the regular and readily available medical masks, the blue ones. Because of this, the government has allotted a proportion of N95 mask supply to frontline workers who are most at risk of contracting COVID-19 and its variants. You can reuse these masks several times if you leave them for 5 to 7 days between each use. If they no longer provide a tight fit around the face, then you should dispose of them. Particulate respirator face masks come in a variety of models, prices, availability, and suitability. However, demand for these has been high, as I mentioned. This category of masks is often identified by which international regulatory standard they meet. P2 is the Australia-New Zealand one, N95 is the US one, KN95 is the Chinese one, and FFP2 is the European Respiratory Standard. Genuine standard meeting masks can be identified by the appropriate standard being printed on the mask itself and its packaging, as demonstrated here. I thought I would touch on children's masks because we've also received several questions about these, especially with kids going back to school and protecting our young and vulnerable populations. So choosing a face mask for a kid is one that fits best and can be worn consistently. The mask should cover their nose, chin, and mouth without any gaps around the sides. These can be a reusable face mask, a fabric one with at least 3 layers, or a disposable medical one. Many face masks come in children's sizes, and you can find a lot of these online. For commonly available medical masks, you can use the knot and tuck method from the video earlier to improve the fit on a child's face. So some things to avoid. So the following types of masks or face coverings provide very little protection against the transmission of COVID-19. Wearing a face shield alone is not recommended as it will provide very little protection against droplets or aerosol spray. Dust masks or masks that have an exhalation valve, are not recommended as they have a one-way valve that allows droplets to spread. These masks were originally made for working in dusty areas such as construction sites, but are not as appropriate for preventing the transmission of disease. Masks that are showing wear and tear and that can no longer be used should be replaced. Look out for any thinning of the material, holes, or if the ties or elastic loops can no longer keep the mask in place. As mentioned in red light restrictions, scarves, bandanas, buffs, or t-shirts are no longer acceptable as face coverings. So these are some of the references that I use to source my information. And thank you all for listening. I do have a wee feedback form that we posted into the Island Bay Peeps Facebook group. So if you'd like to give some feedback, you can do it there. And now I just have a short demonstration. Okay, so I have various different types of masks here with me, and I'm going to use some water to show how they prevent particulate transfer. So if we're going to first start with a cloth mask. So as you can see, it holds the water for a little while, but then as time goes on, the water will spill through the mask itself. It starts to drip. The next one I'm going to look at is the blue medical masks. And as you can see, they have 3 layers, even though they may just look like a single layer. So we have that. And these hold the water for a longer period of time than the fabric mask, but given enough time, it will seep through. Finally is the P2 N95K N95 category. And a lot of these come in different sizes, but they all sort of have the standard that they reach printed on them. Many of these have an electrostatic fabric coating, which means that water droplets cannot penetrate as easily through the mask, and the water just slips right off the front. And when pouring water into this mask, as you'd expect, they hold the water for quite a while and don't let it through as easily as the other ones. So thank you guys for listening, and I really appreciate you listening and hope you learned something. Awesome. I'll pass it back to you, Ty. Thank you very much.
Thank you, Nico. Lots of information in there. I'm going to start with a question. It's a practical one, Nico, and I'm going to fire it at you. So I'm wearing my mask and it's all good, and then I want to cough or I want to sneeze or I want to blow my nose. Like, how do I do that? Like, do I just whip it off or do it like just cough into my mask?
A cough, yeah, you could turn away from other people and still cough into your elbow to further prevent any transmission of any particulates. Sneezing, ideally you could sanitize your hands or wash your hands before touching the mask or face, and then removing it using a tissue, disposing of that, wash your hands again and replace the mask. Hopefully out of proximity from other people.
Cool, thank you. And then I had a question about the N95 masks. Can you reuse those forever? Can you just keep going?
You can use them for about sort of several times, but you need to make sure that they still fit well and don't get wet or any wear and tear in them, because that will mean that they aren't as effective at stopping any particulate transfer.
Thank you. Duncan, I have a question for you. So where can I get these N95 masks or good surgical masks?
It's a $1 billion question sometimes, isn't it? No, look, I mean, you want to just sort of obviously look out for, you know, whether they fit those regulatory standards, and that's checking on that box that they've got their printed standard on the outside of the box, but also printing on the mask. So just making sure that they're all good, probably it's a matter of probably just searching around, perhaps ringing some. I mean, some pharmacies have them at the moment, some don't, and so they sell quite quickly. There may be some online that you may be able to get a hold of. If you are going to go into a hardware store and buy them, just bear in mind what Nico said about the vents. You know, there's no use buying a mask for the vents. So just, you know, you can buy them from a hardware store, but just be, you know, bear that in mind and avoid buying something with the vents.
Cool, thank you. And is there a source that's endorsed by the Ministry of Health for N95 masks? Duncan.
I'm not aware of any source endorsed by the Ministry of Health at this stage. No, I'm not aware.
There's 3 no's.
Yeah, it could be
as long as it's printed on the mask, that's what we go for. Or on the box.
Looking for it. I mean, often, I mean, if there's any issues, it's sort of checking those 2 places on the mask and on the box.
Yeah. Sometimes some masks will just have the brand name on the mask, because they want to promote their brand, but as long as it's got the right information on the box, then that will be okay.
Awesome, thank you. So, well, let's go to you, Marion. I've heard about the paper bag system for reusing masks and disposable masks. What is that and how does that work?
So the paper bag system is just the same as, say, hanging them on a hook. It's just to have them out of the way while you let them air dry so that you can reuse them. So as Nico said, you can reuse a disposable mask a number of times. We know in medical settings, you can reuse a mask for up to 40 hours. So if you're wearing your mask for between 2 and 4 hours a day, you can reuse it 10 times. And you'll probably, for things like just going to the supermarket, picking your kids up, stuff like that, you can probably use them for even longer. And I suspect they'll probably break or get really dirty before you'd go much past 40 hours anyway. So we recommend getting a selection of between 4 and 7 masks and having either one per day, or if you've only got 4, just rotate through those 4. And when you get home at the end of the day, put your mask into a paper bag, label it. You can label them 1, 2, 3, 4 on Monday, Tuesday, Wednesday, whatever is easiest. And then just let it sit there and do nothing until you come back to it 4 to 7 days later. There has been some information saying that Omicron seems to live longer on masks or on surfaces than previous coronavirus variants did, but we don't think that that's necessarily viable virus out to days 5, 6, 7. So it's up to you. And you can do that with your medical disposable masks and the N95 masks.
Oh, okay. So we'll continue with the N95s. Marion, I've heard there are counterfeits around. So
yeah.
How do I avoid getting one of those? I don't want to fake.
Luckily, New Zealand continues to be a small place at the end of the world. So a lot of the counterfeits are in the US and in other larger countries. There was some discussion about counterfeit masks in this country back in 2020 at the beginning of the pandemic when we were really short of PPE. But as far as I'm aware, and I've done a search online recently, we don't have any counterfeit masks that we know of in this country at the moment. And as Duncan and Nico both said, as long as you've got the right information printed on the basket, on the box or the mask or both, you should be fine. It seems the counterfeiters are a bit lazy and just produce ones with not very much written on them. So they're not that hard to pick out.
Awesome, thanks. Nico, so I've had COVID-19. This is a question from one of our people. Do I have to wear a mask because I've already had it? So
you should still wear a mask at all times when you're interacting with other people outside of your home bubble or at your work. If your employer stipulates it, you should be wearing a mask. Yeah, because it helps prevent disease transmission, mainly from you, but also from other sources.
Right, okay.
And as people have probably seen, you can get COVID again. So just because you've had it before doesn't mean you're not at risk of getting it again.
Exactly.
So here's a question for you, Marion. And I know that I have this issue myself. So a lot of us organize events, and we know that there are exemptions for people wearing masks. And when you organize events, you usually ask people to wear masks. What is the best way to manage this when somebody comes and says they have an exemption? Can I ask to see an exemption? And is it safe to have people with masks and not with masks in the same room?
As each other. So as Nico said, wearing a mask is absolutely the best way we can prevent transmission of virus if you've already got it. So we really want as many people as possible to be wearing them. But we also have to be pragmatic about this. And we know that some people really struggle to wear a mask or genuinely cannot wear a mask. And we've taken a pragmatic approach to this and asked New Zealanders to carry on being kind and being tolerant. And I know that everyone's like, do they really have a mask exemption? I would recommend don't get into that. Don't get upset about it. If there's 1 or 2 people at a meeting that aren't wearing a mask, it'll be fine. You're not actually, people don't have to provide an exemption card. And while you can ask to see it, they don't have to give it to you. So, and certainly it would be quite rude and possibly inappropriate to ask them why they can't wear a mask, because that could be quite upsetting for some people, given some of the reasons why people can't. So I recommend being tolerant. The one thing people who don't wear a mask need to do, though, is take those other precautions even more seriously. So you really ought to be staying 2 meters apart from people if you're not wearing a mask and you're in an indoor space. And do try and make sure that any room is better ventilated than you might otherwise do if you've got people who aren't wearing masks. So do your best to make people not feel excluded, but also just be pragmatic about the fact that that might mean everyone needs to be a little bit further away from each other in a meeting.
Awesome, thank you. So we're about halfway through our session, so we're going to pivot and start talking about vaccines. So Duncan, here's one for you.
Yeah.
It's around boosters. Do I have to keep getting boosters every 3 to 5 months? And how long do I have to keep doing that? Is that like for the rest of my life, or tell me?
Yeah, good question. Good question. So we've got to think about why boosters came about in the first place here. What they were noticing after a period of time in elderly patients, especially, was that resistance to COVID infection and whatnot started to wane. And we know that immunity as you age tends to wane. Children have very good immunity, and as you sort of age, that's what happens. So they found in some countries where they tried that the booster increased their cover quite specifically. One thing to note at the moment is we're in an Omicron situation, and so you would have noted that we're squeezing these boosters in quite quickly. And that's the reason for that is Omicron, as you probably all well know, is different from Delta in that it's a lot more transmissible. But the good news is that it doesn't cause as many sort of what we call serious morbidity or mortality when compared to Delta. But when saying that it's no walk in the park, it's very similar to in sort of serious outcomes to the original COVID infection. One thing that I did find the other day that was quite useful about these and interesting about these boosters, especially in an Omicron situation, there was a study in Canada, and they found that adults, after having a second dose, in the situation where for getting sick from COVID, so we're talking about just the mild symptomatic infection, so that's getting ill or mild to moderate infection, getting a cough, getting a sore throat. Getting all those symptoms that you would, like type 1s. The stats for those said that with Delta and adults that had a second dose, 6 months after their vaccination, it was 90% effective at preventing symptomatic infection. And then when they gave them a booster, that increased it up to 97% effective against getting a symptomatic infection. So that's really good for Delta. But Omicron's a different story altogether. So they found with Omicron, after that second dose, you're only 36% effective against the symptomatic infection. Once that second dose moves out to about 60 days afterwards, there's not really any. You're going to get sick. You will get sick after having 2 doses of the vaccine. Now, how sick you get's the next question. But when they boosted them up and gave them a booster for symptomatic infection, 61% of people, it was 61% effective at preventing a symptomatic infection. Now, the really interesting piece moves over to your severe outcomes, and that's the things we're talking about. You go into hospitalization, and the most severe outcome being death. Now, after that booster dose, when we're talking about giving someone a booster with Delta, 99% effective at stopping them from dying or going to hospital. And with Omicron, still really, really strong, 95% effective at controlling that. So in answer to your question, going back to it, because I've danced around it a bit, it's really important to get a booster to reduce that severe infection risk. Will we need to keep getting them? Well, we don't have a crystal ball. But in Israel, a fourth booster is licensed and it's being used over there. And as we start to see real-world data coming in, we'll have a better picture. A 4th dose is currently not licensed in New Zealand, but there is an Omicron booster coming through in development, and that might be what we're getting as our 4th dose. It may not necessarily be this thing that we're getting now, but it may be an Omicron booster, or it might be another variant, and this other one might not be relevant. Is there anything else you wanted to add in there, Marion?
No, I think you've explained it extremely well. The only thing I would say is for people who all these medical terms about symptomatic and severe and all the rest of it, we really care about whether you come to hospital and whether you end up in ICU or even sicker than that. You can still be pretty sick at home for a good couple of weeks, feeling pretty dreadful, and we call that mild disease. So, so when we're talking about, you might only have mild disease, that just means you're pretty sick at home, all the way down to asymptomatic.
Cool. Right.
Mm-hmm.
Let's Marion. So there's been a bit of talk about the 3 different options for vaccines in New Zealand. There's Pfizer, AstraZeneca, and Novavax. Should I choose one of the standard Pfizer ones, or should I go for the soon to be available Novavax? Which one is the best and why?
It's the best. So we've been really, really lucky throughout this pandemic because of the decisions that we made as a country in terms of holding it away from our borders for so long. And that means we've been able to watch what everyone else has been doing. And about 300 vaccines started out in development at the beginning of 2020 when people first realized that this would be a big deal. And about 25 of them have come to the market. The reality is, those mRNA vaccines, which are the Pfizer and the Moderna ones, and we've got the Pfizer, are just pipping all the others to the post in terms of how good they are. They also seem to have the mildest side effects, and I know there's a lot of talk about the myocarditis side effect with all of these vaccines, and that's because coronavirus gives us myocarditis as well at quite a high rate. And so the immune response to the vaccine can also cause myocarditis, but at way lower rates than any of the others. And Pfizer actually comes out pretty much the best as having the lowest rate of those sorts of side effects. So we were really lucky that we got Pfizer as both our first option and our most available option. So that was great. And it also meant that almost nobody had any problems with it and adverse reactions. But as with all medications, there's always a few people who can't have it. And there's always a few people who just want to feel like they might have a few more choices in the matter. And so we did buy some AstraZeneca vaccine. Is still very effective. And when we're talking about more effective or less effective, we're talking a couple of percent. As Duncan just said, we're talking 90% effective for all of these for preventing severe disease, and even up to 95 to 100% for some really bad outcomes. So the AstraZeneca is really good, but it does have a few more side effects. And that's why it's really good if you want the AstraZeneca, or if you can't have the Pfizer vaccine, you go and talk to your GP about it, because they can talk you through some of the other rare side effects that can happen with that one. Novavax is very new. We agreed to buy some Novavax last year when it first looked like it was getting off the ground. It's a similar vaccine to the flu vaccine. So there are a few people out there who are wanting to stick with this because they feel more secure in knowing the old technology, the stuff they've always known, that they've had flu vaccines for many years. But unfortunately, Novavax have taken a while to get their vaccine through all the regulatory procedures. Mostly, it has to be said, due to manufacturing, to being able to make it at the scale they need to, rather than because it's not such a good vaccine. It hasn't been tested on millions and millions of people like the other ones have, which does make it we don't know quite what it's going to do in terms of side effects yet. It's probably going to be similar to the flu vaccine, which is a very safe and effective vaccine as well. And that's going to be available in New Zealand in the next few weeks for people who would prefer it, or the very, very occasional person who can't have Pfizer or can't have AstraZeneca. At the moment, Novavax is not registered anywhere as a booster. So for booster doses, you need to stick with Pfizer, which is probably the best, or AstraZeneca if you can't have Pfizer.
So, okay, thank you. Duncan.
Yes.
So people have told me that it's an experimental vaccine and it is unsafe because it was developed really quickly. How is it possible that they just made this vaccine? Like COVID came and then suddenly we have a vaccine. How did that happen?
Well, I mean, it's a real example. I mean, this virus coming about, it's a real example of the world working collectively with the common goal for humanity And to give you some assurance that the technology has actually been around for decades. So it's a mRNA vaccine. To give you a bit of history, mRNA was first discovered in the 60s, and research started into how to deliver it into cells in the 70s. And it was first tested in the 90s. So it was tested back in 2013 for rabies as a vaccine. And the problem was that they found mRNA, it was very difficult to get that delivered into the cells to be taken up and then, of any use. So the issue sort of more was encapsulating the mRNA to deliver it to the cells to be able to produce the spike protein that it produces. Well, in this case, the spike protein, but in those cases. So I mean, an envelope sort of was developed, and the first type using one of those envelopes was the Ebola virus. You may remember that a wee way back. It was many years ago as well. But that's sort of the virus. It didn't end up getting developed. The Ebola virus, got under control and fizzed out. And then the COVID. So once COVID-19 came along, it was all ready to go. The whole technology was there, and the opportunity to prove its safety came out with that. So I mean, we're talking the open source spike protein, and the whole world sort of. I mean, it may take a single drug company 10 years to develop a vaccine, but if you can imagine the amount of work and whatnot that's gone into it, and the amount of research and whatnot by so many people in the world, then they've had an opportunity to prove its safety. The other thing is, of course, we've got all this real world data of it being used, and it's proven to be one of the safest, and also the efficacy of it is amazing as well. You're talking 95, 99% effective. Originally against, 95% originally effective against symptomatic infection. I mean, if you can get that with other vaccines, it's amazing. And the other thing is the mRNA that goes into the cells, produces a piece of protein, and then that piece of protein is the spike protein in this instance, but it can be developed for other types of diseases as they present themselves as well. So, I mean, it's pretty amazing vaccine, really. So, hopefully that answers. Yeah.
Globalization at its best.
Yeah, exactly. Yeah.
So I'm just going to go back to boosters, Marion. So why do we have, like, if the vaccine works and we get like the 2 jabs, and then why do we have these boosters? Like, why? Like, some of my friends argue that means that the vaccine doesn't work because we just have to keep getting jabbed.
Booster shots. Yeah. So booster shots are really common in loads of vaccines. As a child, you'll often have more than one of each of the vaccines. You go in as a baby or as a toddler, and you get vaccines on a schedule. So you get a booster shot every few months, or even every 2 or 3 years, just to build up your immunity. But it builds it up in a way a lot of people don't understand. So when you first get the vaccine, it stimulates the very, very beginnings of your immune system. And it's what we call antibodies. You've probably heard people talk about testing for antibodies to see if you've had COVID and see if the vaccines worked and this sort of thing. So your antibodies get produced first, and they're like, oh, hang on a minute, this is something a bit weird. We should know about this and do something. And the second dose just primes it to go, oh, okay, this is something we need to pay attention to. But they kind of scurry off back to the lymph nodes and hang out there. And then you don't actually meet the virus. And so what happens is everyone kind of, has a bit of a snooze, your immune system. If you give a booster dose, it reminds the immune system that this virus exists and it's a really big problem, and it decides to get at the big guns. And so it gets at the T cells, and those T cells kind of line up in readiness to be there at the drop of a hat if that virus comes along again next time. And so they're a much stronger type of immunity than those first antibody type immunity that we get with the first 2 doses. So if we all had the first 2 doses and we're net Omicron or any of the coronaviruses 4-6 weeks later, we'd have probably been fine. But because we've managed to stave it off and we're meeting it a number of months later, actually we need our immune system to be boosted, to be woken up again and reminded that this is a big deal. And it may well be, if we can get, as Duncan said, variant-specific boosters, which are in the pipeline and coming, that'll be excellent, because then those big gun T cells know exactly which guns to put at the front and can get them out really, really quickly. And you might even get a coronavirus Omicron, and your immune system works so fast because of those booster doses that you don't even know you've had it, and you wouldn't be transmitting it to other people as well. So given that these viruses, we know, can cause quite significant illness and quite significant consequences, even to people who've not had a very severe illness, it's much, much better to protect yourself using boosters than to protect yourself by getting the infection itself. And we use booster doses for tetanus. You're supposed to have a tetanus booster every 10 years. If any of you have stood on a rusty nail, I'm sure the ED department were very keen to get a booster tetanus into you. So it's not that this doesn't happen with other vaccines. This is how the immune system works, is that need for boosting. And we don't know, maybe we'll only need 1 more or 2 more booster doses, because actually coronavirus will get less infectious and less severe and melt away. Maybe it'll get more severe and it'll be around for a long time, and in which case, let's protect ourselves the best we can with vaccine doses as they come along.
Well, okay, thank you, Marion. So Duncan, I hear that you've been on the front line of giving out vaccinations. So this one's about a child. So the child is turning 12 at the end of September. If they get them vaccinated now, they'll get 2 child doses. But if they vaccinate them, there's a possibility of getting a child dose and then waiting till after 12 and then getting the adult dose, due to timing of birthdays and such things. What are your thoughts on this? Risks, advantages?
Yeah, that question's been asked a few times actually, and I think people sometimes they get a bit confused about medication doses and what's appropriate for certain ages of medication, and vaccine doses and what's appropriate for that. Because I mean, you may also see we get kids of various sizes as well, and whatnot. The most important thing that's in consideration for the pediatric Pfizer dose, and it has a tenth of the adult dose, sorry, a third of the adult dose in there, is not necessarily the the dosage and how much of it is that you're getting in it. It's based and developed on the maturity of the immune system, and so as you age, that usually reflects that sort of that age you are as that immune system develops up. So my advice is always get it now and get it for what the age appropriate doses, and probably more so, the pediatric dose is sufficient for the age of the immune system of the 11-year-old. It's also probably most likely efficient for 12, 13 and 14-year-old as well. So it's not necessarily worrying, oh, they're not getting enough. It's making sure that you're using what's appropriate for their immune system. As I mentioned before, that young immunity is quite strong and quite good, and as we age, it tends to wane a bit as well. So yeah, so that's probably most appropriate there.
Cool. Okay.
Mm-hmm.
So let's carry on with children, Duncan. So I've heard kids can get their second dose from 3 weeks, but the booking site only allows me to do it in 8 weeks' time.
Yep.
How long should we wait for an 8-year-old to get their second dose?
Okay, so yeah, it's a good question as well, because I've been asked that again. A dosing interval of 8 weeks, it has been shown to give better and longer lasting immunity. It is licensed to be able to be given at 3 weeks. In certain instances, but usually that advice is in certain instances of children who are most at risk of really severe diseases. So kids with severe heart or lung or immunity problems, and the priority is getting them the most fullest protection the quickest if the disease surges, which is what we're seeing happening now. So yeah, I mean, basically, they get a really good immune response actually from dose 1. And as I said, 75% effective after 1 dose from symptomatic infection. So that's what I talked about earlier, getting those COVID symptoms and whatnot, and an 85% protection from hospitalization. And when you compare that with 3 doses of adult Pfizer, versus Omicron is at 95%, we're getting a pretty good response from just that single dose for the children. So the imperative to get that second dose early isn't really raised. It's more important to sort of work on those T cells and those B cells and all those other sort of, immune memory type cells that we're getting as we get that second dose a little bit later on in the season, and getting really strong antibodies. And you'll note that boosters aren't licensed at the moment for children, and that's again, it's not being presented to BidCert, and it's not been licensed at all at this stage. So at the moment, we're just giving those 2 doses and hoping that will be sufficient. But again, no crystal ball. We don't know what's going to happen in the future. So yeah.
The future. Thank you, Duncan. Marion, I have a question. This question is about vaccinations' impact on transmissibility. Is there the data to support the theory that unvaccinated people are more contagious and for longer than vaccinated people?
Oh, yeah. So this is a moving target as this particular coronavirus has mutations and variants and things like that, and also it's quite hard to measure the answer to that question, how transmissible it is, because of levels of vaccination in different populations out in the rest of the world. So different countries have got different levels of vaccination. They've also got different levels of the amount of COVID that the background population has seen, because some countries where we're doing these studies have had 4 waves of COVID come through, and so many people have caught the virus as well as been vaccinated. Some have just been vaccinated, some have just caught the virus, and so working out who's causing more transmission and who's causing less transmission is really muddy. There was a study done in the middle of last year, a couple of studies actually, that seemed to show that it didn't make a lot of difference, that you could still transmit the virus if you were vaccinated, almost as much as unvaccinated. But there was another study done really recently, which did include the even newer variant of Omicron, the BA.2 variant, and that showed that vaccinated people transmitted the virus about half, a little bit more than half, what the amount that unvaccinated people did. And the other thing that's really important in vaccinated people is that the amount of virus in their nose and mouth decreases really quickly within a couple of days. And so they're transmitting the virus for fewer days once they've got it. So that's the other reason that yes. So the answer is yes, vaccinated people transmit the virus less than unvaccinated people, but it is confusing. And the reason it's confusing is just because COVID's a bit of a mess out there at the moment, and we're busy trying to work out what the right thing to do here in New Zealand is, and we're different to everybody else, so we've got to make judgment calls based on quite messy information.
Right. Okay. No straight lines with COVID, it sounds like.
No.
Here's another one for you, Marion. So some of my friends are unvaccinated. Others are in vulnerable health. I don't want to be a vector for transmission myself, and I'm vaccinated, including the booster. I'd like some science with which to have the conversation with the unvaccinated friends as they are feeling hurt, that I don't want to spend time with them, and I'd like to explain to them that it's the risk, not their values, that are keeping me away.
Yeah, I mean, this takes us back a little bit to the how do you approach someone who's not wearing a mask. There's science, believe it or not, behind kindness and building trust and honesty, and that's about with your friends being reliable, micro moments of honesty, and telling people how you feel. And I know, emotions are running high at the moment around people's different values, value systems. But the reality is, especially if you might be in contact with someone who's likely to get severe disease with COVID, and that can still happen with Omicron, even though it's milder than Delta, and it can happen to vaccinated people who are vulnerable as well. They are still our highest risk group. They may not die, they might not be on ICU, but they might end up with long-term side effects, and they don't want that. And as I said a minute ago, you are more likely to transmit the virus if you catch it. If you're unvaccinated and you've got it, and while you're less likely if you're vaccinated, you can still transmit it. So I'd say be really honest. Be honest about where your feelings lie, that you've got, you're being pulled in multiple directions. And if you do want to meet up with those unvaccinated friends, make it outside, stay 2 meters apart. You can still have a good conversation from that distance. And just be aware, it's not going to be forever. We just have to get through this phase. And I know it feels like it's forever at the moment, but it really isn't. We just haven't had to live with a pandemic for decades and decades. So we've got no idea of how long these things go on for, but it won't be forever.
Awesome, thank you. Duncan. So I've been told by a nurse that when a new strain comes out, and this person makes it sound like a blockbuster movie, which was exciting, not what actually happens. It replaces the previous one, and I've noticed that the original COVID isn't in the stats anymore. I know that our government is not differentiating between Delta and Omicron in New Zealand stats, so I can't get clarity there. I was worried that everyone would forget about the risk of Delta. Then I realized I don't know if it's still a live issue. Can you please advise?
So yeah, when new strains come along, it seems to be the thing about viruses that they tend to be more infectious than the others, and that's what we're seeing with Omicron. It's a lot more transmissible, and the old strains don't tend to take hold because this newer strain tends to be taking over and whatnot, and so the old strains aren't causing the infection; it's getting caused by those new ones. And it's all goes back to sort of evolution, I suppose, and viruses just evolve really, really quickly. And success of an organism lies in its ability to replicate itself. So if you look at Omicron, it's got 50 mutations from the original coronavirus, and a lot of those tend to be on that spike protein. And so that's how fast those viral vectors move along and evolve. The problem is viruses need living cells to do it, and in this case, to replicate, and in that case, humans. And the worst thing a virus could do is kill its host before it was able to replicate and pass things on to a new host. So Omicron does result in a lot, in these reduction in these serious outcomes, but it is more transmissible, and it tends to be the most prevalent strain that we're seeing at the moment. Let's hope it sort of continues to sort of go down that thing where it starts to get more mild and whatnot. That would be great if it turned into what its other cousins coronaviruses are, and those other coronavirus cousins tend to be just common colds. So who knows if we see that, and hope it doesn't get a lot more lethal. So anything to add there, Marion?
No, I think that's very good. I mean, there have been other variants of COVID, apart from the ones we've all heard about. Omicron's quite a long way down the Greek alphabet, but they never came to anything, and so they died out on their own. And so we spotted them and named them, and then went, oh, okay, then it's been out competed by something else, and along has come something else. So that's why Delta. There's still a little tiny bit of Delta around in New Zealand, but not very much. It's almost all Omicron now, and will probably stay that way until who knows the next thing that comes along. And as Duncan says, fingers crossed it comes along milder rather than more severe. Omicron, of course, is milder than Delta, but it seems to be about as severe as the original coronavirus, the original COVID, and the Alpha variant, which was the first variant of concern that developed in the UK back in 2020. So it certainly isn't something to be taken lightly.
Cool. So I've got one last question, and this is going to you, Nico. It's from today. So this person has been using P2s and was lucky to get some when they were still $40 for 50. Awesome. They seem to fit a lot better than others they've tried, but still don't feel like a close enough fit. Example, glasses still fog a tiny bit, but way less than the normal surgical or cloth ones. They've tried shaping the nose bridge, but what else can they do to make them fit better?
With the P2 style masks, you can use a clip to further put some force on the front of the mask to pull it back and hopefully get a bit of a tighter fit. If a person has a lot of facial hair, they may consider trimming that so it fits tighter onto the face. And then you can go also see your health professional to work through test fitting these sorts of masks to you as well. But
Yeah, the other thing I'd add, the 3M masks that we're using in the hospital have got a little bit of foam over the nose bridge as well that comes along here. And so I do know some people who are actually fitting, yep, there we are, Nico showing you, that are fitting a little bit of window foam. You can get window foam as a draft excluder, and you can buy it fairly cheaply in Bunnings, and you can chop a bit of that up, and it's self-adhesive, and you can just put it on the inside of your mask before you start using it. If I don't know if the adhesive is strong enough. If it isn't, you could probably apply a bit of double-sided sticky tape or something like that to seal it on. Glue, like super glue, doesn't work on these sorts of fabrics. So if you were going to use a glue, you'd need to do a little bit of investigation as to which one. But a bit of foam would be quite a good air blocker to stop air coming up towards your glasses. And in the hospital, when we're wearing surgical masks, we'll often put a bit of tape over the top, which obviously we're wearing them for long periods of time, so we're not having to take the tape on and off, but a bit of micropore works very well for stopping glasses fogging and just increases the fit.
Awesome. So Nico, thanks Marion. Nico, you said health professional to help you with your mask. Who's that? Is that your GP? Is that the...
Well, probably the most accessible is dropping into your pharmacy, and we can have a chat either with the pharmacist or with people who are informed about that in the store. Going to your GP probably isn't as advisable, just because it will kind of clog an already burdened system. Busy time, but yeah, pharmacists are probably the most accessible people.
Oh, awesome. Okay, thank you. Wow, I think we've run out of time. That's an overload of information. So I'm definitely going to be watching the recorded version again, just to get my head around some of those things. But thank you very much to you all for sharing your knowledge and being generous with your time. I also just want to thank our sponsors, Island Bay Enhancement Trust, Unichem Island Bay New World, Wellington City Council, Island Bay Community Centre, and ACE Aotearoa. And I'll just finish with a quick karakia. Kia tau, kia tātou katoa, te ao, te aroha, me te maru tau, tihei Māori ora. May peace, love and safety be upon us all. Tihei Māori ora. Thank you very much for joining us.